Welcome to the OSCE examination of cervical lymph nodes. The preliminary steps. Greetings to the patient. Introduce yourself. Take permission for examination. Position of the patient, sitting position. Exposure, head, neck, and chest. Wash warm your hand. Second is inspection. In the inspection, you have to inspect all the draining area for the cervical lymph nodes. These include the face, the scalp, the ears. Also, you have to examine the mouth. Use tongue depressor and torch to examine the tonsils. Examine the adenoids by indirect laryngoscopy. Inspect the tongue, the gums, the teeth, the mucous membrane, the lips, the neck, the upper chest, the back, in palpation, you have to describe the followings. Whether there is enlarged lymph nodes, number of lymph nodes, tenderness of lymph nodes, consistency, rubbery or firm, and if there are more than one, whether they are matted together with adhesion or separated from each other, we describe it as discrete. Now to palpation. We have the anterior approach and the posterior approach. I will start with the posterior approach. You put your thumbs in the mastoid process and examine by your fingers. We have first the segmental lymph node groups. These located below the chin. You do palpation in a clockwise direction. Then we have the submandibular located below the body of the mandible in a circular way. We have the tonsillar below the angle of the mandible, and we have the pre-auricular lymph nodes. Now we come to the anterior approach. In the anterior approach, you examine the suboccipital and post-auricular lymph nodes. Post-auricular, we ask the patient to flex the neck 15 degrees to put the sternomastoid muscle in relaxation, and you examine the superficial and deep lymph nodes, jugular lymph nodes, superficial and deep jugular lymph nodes, upper, middle, and lower. The lower is the supraclavicular lymph nodes. and then you go to posterior triangle. You examine for the lymph nodes in the posterior triangle. The posterior triangle located between the clavicle, sternomastoid, and the trapezius muscle. The clavicle, sternomastoid, trapezius muscle, you examine, palpate in a circular way, anti-clockwise, for the lymph nodes. You have to do examination bilateral. If you find any enlarged lymph nodes, you should look for other lymph node groups enlargement in the axilla and in the inguinal region. And don't forget to examine the liver and spleen. At the end, you should thank and cover the patient.